Welcome back. November marks the start of American Diabetes Month. Here to discuss Montefiore Health System's clinical diabetes program and the effects of this health condition is Dr. Rita Louard. Doctor, thank you so much for joining us.
It's a pleasure.
So, can we first just start off by talking about the clinical diabetes program at the Moses campus of Montefiore Health System?
So the clinical diabetes program actually encompasses both the Moses campus as well as the Einstein or Weiler campus. It is a program where we deliver care to people with diabetes in our clinics and in our practices, as well as education for patients with diabetes.
And I'm really interested to hear, we're going to learn a little bit today, but can you tell us more about those educational opportunities?
So we have a nationally awarded program called the Promise Program, which is a diabetes education program geared toward people with type 2 diabetes. And what it is, it's a multi-week program where we talk about a lot of the issues. Why you want to reach certain targets, how you can reach certain targets, what is the best thing to eat, how exercise can affect your blood sugars. It is a comprehensive program where patients with diabetes not only get education, but they get support.
Now, I want to actually talk about the condition itself. So, what are the two types of diabetes and how do they affect your health?
So there are two basic types of diabetes. There's type 1 and type 2. Type 1 diabetes develops because the cells in the body, the cells that are in the pancreas, are attacked by an autoimmune process and the body stops making insulin. Type 1 diabetes we typically see in younger adults, but we can see it in any age group. And in fact, I've had patients as old as 90 presenting with type 1 diabetes. Type 2 diabetes is the diabetes that we see when patients have two different conditions. One is their body is having to make more insulin because of something called insulin resistance. And so you have to make more insulin to get the same effect. And at a certain point, the cells in the pancreas again start to fail and you're not able to maintain their blood sugars in a good range. Type 2 diabetes is a more common type of diabetes. And kind of like type 1, we're now seeing it in younger adults, younger patients with diabetes up to as low as the age of 10.
So, can you just tell us what is pre-diabetes? I've seen a lot about that as well.
So prediabetes is a condition where there are abnormalities of glucose, not at the point that you actually have the diagnosis of diabetes, but abnormal. And so prediabetes can be defined with a blood test called the A1C that is between the normal range, which is less than 5.7, and 6.4, or a blood sugar in the morning, let's say between 100 and 125. We care about this because people with prediabetes are at risk for developing diabetes, and it's at a time where we can actually do something about that risk.
Now, according to the CDC, more than 1 in 3 US adults have pre-diabetes, but the majority of people don't even know they have it. I think that's very alarming and it's a little scary. Are there symptoms that people should look for, and how would they know?
So, one of the problems with prediabetes is that you may not have symptoms. And so, the reason that we want people to come in to their doctors, their primary care, is to get that diagnosis because it is usually a blood test that tells us whether they have prediabetes. Although there are certain risk factors, being overweight, having a family history, being of certain ethnicities, that may increase your risk of developing not only diabetes, but prediabetes.
Now, according to NewYorkCity.gov, diabetes is the fourth leading cause of death in New York City, and the number of adults diagnosed with diabetes has tripled in the last 20 years. Do you have any idea why that number is so high?
There is a close link to obesity. And so when we look at the rates of obesity, not only in New York City, but throughout the country, those rates are going up dramatically. And following that, you can see the increase in the rates of diabetes. So there is a link to obesity, but there are also other things that can increase your risk for developing diabetes. We talked about the family history. We talked about being of certain ethnic groups. All of those things can work toward increasing your risk.
Now, I'm really interested, like you mentioned ethnic groups, and I read that Latino, Black, and Asian adults who are 65 years or older are most commonly in this group to have diabetes. Why are we seeing this disparity?
So there are two reasons. One is people who are older are at higher risk for developing diabetes. So 25% of the adults over the age of 65 will have diabetes. But when you add to it some of the other risk factors like certain ethnicities, Hispanics, non-Hispanic Asians, African Americans, Native Americans, all of that will add to the risk for those over 65. So yes, we have kind of twin threats leading to that increased risk.
And now this is kind of just something that came out of this. I just thought of this just now. Do you think like I always hear that sometimes like our food that we eat, maybe it's cultural. Do you think that plays a part or is it economic? Like why do you think, is there another reason why we may be seeing that?
So one of the things that we know is that certain socioeconomic groups are at higher risk for developing diabetes. So the lower socioeconomic groups are also seeing an increase in the risk of prediabetes and diabetes. Part of that may be the food choices, and it's not necessarily the ethnic food, but the fast foods that people are going to. They're cheap, but they have consequences.
Okay, thank you so much for that. Now, do we have any tips to help manage pre-diabetes and possibly prevent diabetes?
There was a wonderful study called the Diabetes Prevention Program, where they looked at people from multiple age groups as well as multiple ethnicities to see what would work to decrease the risk of prediabetes. And what works is losing weight, right? Losing somewhere around 10 to 12% of your weight can decrease your risk of developing diabetes. And the other thing was exercise. And so from that study, we now know that getting people to about 150 minutes of exercise per week would decrease their risk, and it doesn't matter what age group you are. So it was actually more dramatic in those over 65. So you don't have to join a gym, but you should be walking, you should be moving, and you can work up to that 150 minutes a week.
And is there any, type of food that we should like try to stay away from and then foods that we should try to gravitate more towards?
So I believe in vegetables. I think they are so cool, right? And there are a need to actually have more vegetables in our diet. So I kind of use this for myself. I do the plate method where I divide my plate in half, and half of that plate should be vegetables. And I tell this to some of my patients, they're like, what? But you can move toward that. You can decrease the starch that's in the plate, decrease the protein in the plate, and have a plate with wonderful vegetables.
Now, I'm curious to know, and this just came off of my head just now, how hard do you think that transition is for a lot of people, especially those who live in low income areas?
It is very difficult. And I think, it's not something that every patient can do by themselves, but I think as a system, as a community, we should be promoting healthier eating. We should be promoting community gardens. We should be promoting more vegetables in stands. So it is not only on the patient, but yes, it's difficult. It is very difficult.
And then how do you like if we add kids into that mix, because I know that you said that sometimes children as young as 10 can be exposed to this. What advice do you have for parents who are trying to get their child on that transition as well?
So I think the advice is the same. I think to the extent that we can keep our kids moving, and that's going to be a little harder with the pandemic, but that exercise, it's the same for them. They should be doing at least 150 minutes of whatever they like a week. And to get everybody to do a healthier diet is it's not actually a punishment. It's a good thing to eat more vegetables. Popeye. Oh,
Okay,
sorry.
no, no, it's okay. So, what are some options for those who do have diabetes or pre-diabetes?
So I want people to realize that the diagnosis of diabetes and prediabetes is an opportunity to actually change some of the things we're doing, right? That eating healthier doesn't mean that you're punishing yourself. You actually can feel better losing that 5 to 10% of your weight. You can feel better after you take a walk around your park or your local garden or your street. So, incorporating that into your life, incorporating that 150 minutes, incorporating the fact that you may not get to that half plate, but more vegetables is a good thing.
And how can people stay in touch with Montefiore?
So I believe there's going to be something on the bottom. So Montefiore, we have activities throughout American Diabetes Month, which is November, throughout the community. We have a website, and so if you want to know what's going on, you can refer to montefiore.org, Diabetes Month at the Montefiore Health System. And even in the off months, the months that are not related to American Diabetes Month, there are activities throughout the Montefiore Health System. So stay in touch.
All right, wonderful. And then one last question about the program. Is there a certain, like, what do people have to do to join that program?
So we have a number of different programs, but for the Promise Diabetes Education Program, they need to just get a referral from their primary care doctor. And if they stay on that site, there are other activities throughout the community that are done throughout the year. So they will stay connected and stay informed.
All right, wonderful. Doctor, thank you so much for joining us.
It's been a pleasure. And American Diabetes Month, remember, November.
Thank you. We'll be right back with more Open BXRX Tuesday.